Rising COVID cases in India have increased the burden on the testing system. People are not only rushing to get RT-PCR tests, but also CT scans of the chest, especially as RT-PCR test results are getting delayed. So, do all patients of COVID-19 really need a CT scan of the chest? Let's find out. What is a CT scan? A computerized tomography or computerized axial tomography scan combines data from several X-rays to produce a detailed image of structures inside the body. A CT scan can be used to visualize nearly all parts of the body and is used to diagnose disease or injury as well as to plan medical, surgical, or radiation treatment.
Most of the patients of COVID are either asymptomatic or mildly symptomatic. So in such situations, we don't need a CT scan. CT scan is only required in patients who are having moderate to severe disease, and that too in certain criteria. Something like the patient is having persistent fever for 7-8 days, the fever is not responding. When you are not really sure whether the lung infection is significant or not, that is the first criteria. The second one would be when the patient has started developing hypoxia. That means the oxygen levels have been started dropping. In such situations, whether to hospitalize the patient, whether to continue the home quarantine, is the time that we do a CT scan to find out whether there is significant lung infection. Third criteria would be, I'm suspecting COVID, but the COVID report has come out to be negative. In such situations, I'm not sure whether I'm dealing with COVID or not. The symptoms look like that, and given the current pandemic, I need to be doubly sure whether it is COVID or not. So in such situations, I would do a CT scan. There is no standardized international criteria that when you should do a CT scan. It is all experience based now. So my personal criteria would be, patients at least more than 6 to 7 days, because initially for the first week, the CT scan does not show significant changes. The virus is still spreading in the lungs. At the end of 6-7 days, when the body starts mounting a response to the virus, is the time the CT scan shows some changes. So if you do a CT scan initially in the first 5 days, the CT scan might show normal changes or it might show very mild changes. You might be fooled with the fact that I'm having a very mild COVID. I did not be hospitalized, but that is not the case. The CT scan starts showing some changes after day 5, day 6, and the ideal time would be around day 7, day 8, when you are suspecting whether the COVID is severe enough to be hospitalized or not. But mind you, it is not the only criteria to get admitted. In fact, you need to rely on multiple criteria, like how much is the fever quantity, like what is the age of the patient, like what are the comorbidities like in a particular patient, what are the oxygen levels like. All those criteria, the inflammatory markers, CRPs, and all those markers ultimately end up deciding whether you need to be hospitalized or not. But first week, definitely not required to do a CT scan. Second week, based on the symptoms, based on the other criteria, we think about whether we need to do a CT scan or not. CT scan will tell me whether it looks like COVID or not, because the changes are very, very specific for COVID. The COVID RT-PCR report is only 50 to 70% sensitive. That means if I have 100 COVID patients, I do a RT-PCR in them, only 50 to 70% of the patients would be having COVID positive. We'll end up missing 30 to 40% of the patients. But in a CT scan, it is more sensitive. So if I take 100 patients who are having COVID, I do a CT scan after, like, say, day 5 or day 6, I'll pick up at least 90% of the patients who are having COVID. So in such scenarios, it is a better sensitive test to determine whether the patient is likely to have COVID or not. But most of the other patients, as I mentioned, 90% of the patients are either mildly symptomatic or asymptomatic. There is absolutely no role of doing a CT scan and following up with a CT scan. Some people are doing 2 CT scans or three CT scans. That has absolutely no role at all.